All right, so case management. This is not managed care. Managed care, again, is coordination of care so that there's a smooth delivery of services. Case management is all about caring for the individual, single people. It's part of coordination of care. In fact, focuses on coordination of care. And it also reduces costs because of that. It assesses and plans, it implements, and it coordinates, monitors, evaluates. It helps individual people. Managed care is the big thing. Case management is focused on one person. It's very effective in providing care, but not all patients need this level of intensity because it is very intense care. Managed care, big picture. Case management focuses on the sick people, the people with the expensive chronic diseases, congestive heart failure, cancer, heart disease, diabetes, asthma. These are chronic conditions, never going to go away, and they can only be controlled. They're only controlled with the proper care. Case management provides that care. The case management provides a person who calls up their client list to find out, how are you doing? If you have CHF, when you weighed yourself, what did you weigh? What have you been eating lately? Have you been taking your pills? Are you able to breathe? It's simply a person calling to check or stopping out to visit to keep them out of the hospital. That's the whole goal of case management. Again, we want to keep them healthy. We're not going to cure anything, but we want to keep them from getting sicker. Now, there are two types of tools that case management uses. There are clinical pathways, also known as care maps, and there's disease management. They both help case management, but they're used in very different situations. Clinical pathways, care maps, are used inside hospitals. When the patient is hospitalized, they trigger the clinical pathway or care map. Now, a care map is exactly that. It is a map that details exactly what needs to be done at what time. When I worked in the critical care unit and a person had open heart surgery, we had a care map that mapped out hour by hour exactly what had to be done. When we would draw which lab, we would draw potassium, we would draw PTT, we would draw CBC exactly at specific hours. There'd be therapies written out. Care maps are multidisciplinary. So a care map wasn't just nurses. It involved respiratory, it involved imaging, in lab, and anesthesiology, dietary. Everybody had their spot on that care map. It was a multidisciplinary approach to providing the same care to each person with the same condition. These are based on best practices. There's specific timelines. And in doing so, it ensures that the patients are receiving the best care every time and being discharged on a timely basis. Now, what happens if your open heart surgery is doing fine and then at 24 hours they develop an infection? That's going to set them behind. That's called a variance. And it would actually add a new branch to the care map. Or if you have a person with two conditions, suppose you have a person who had a heart attack and diabetes, you would trigger two care maps. And you would overlay them one on top of the other and ensure that all the various timelines are met for each condition. These are based on experience and best practices, and they are always evolving, but they're designed to move the patient smoothly and quickly from admission to discharge. Care maps are only used in the hospital, and their goal is to get the person out of the hospital as quickly and safely as possible. Care maps are inpatient tools. Only inpatient tools. Disease management is used outpatient. So my person who has diabetes and heart disease would be followed by a case manager, and they would use disease management tools to keep that person from being hospitalized. Remember, they'll probably call that person, ask them to fax them their blood sugar numbers, check their blood pressure on a regular basis, might come out there and do occasional labs, check for enzymes, check diet, check exercise. Maybe they would encourage them to wear a Fitbit and start moving more. Disease management supports the physician-patient relationship and plan of care. It emphasizes prevention, not cure. They already have the disease process. It uses evidence-based practice guidelines and empowers the patients to stay healthy. It includes the patient in everything. They know exactly what's going on and what has to happen and why it has to happen, because there's consequences if they don't. So disease management, these are chronic conditions that never go away and are expensive and prone to causing hospitalizations. So I mentioned a number of them: cancer, diabetes, CHF, COPD, arthritis, high blood pressure, and there's many others. So that is what care management or case management is all about. Case management uses two tools: clinical pathways or care maps. Each organization uses a slightly different term for that, and those are used when the person is in the hospital. Remember, there's timelines, multidisciplinary approach, and designed to get that person discharged safely and quickly. Treating everybody the same, using the concept of justice, so that everybody with the same disease process is treated exactly the same. And then there's disease management, which is used before they go in the hospital and after they go home. Disease management is a preventative service. It keeps them from getting sicker. Many diseases can be controlled to the point where they don't get sick. They just don't get perfectly healthy. So, case management, a key concept for healthcare economics, because both are designed to save money. Preventing hospitalizations are very expensive, and having the person discharged from the hospital, because again, hospitalizations are very expensive. If you can save one day, you're saving tens of thousands of dollars probably. Come back for part 3. We're going to talk very briefly again about evidence-based practice.